Let's be real, parenting is not easy, but you are not alone. Welcome to The Parent Prescription, a podcast where I will give you real, practical advice to help you navigate the ups and the downs of raising healthy, happy children without losing your mind. Most people think they know how the ER works, right? But once you're actually inside it, the reality is it's very different. I've already talked about when to go to the ER, and I've even spoken with the nurse practitioner that also works at the ER. But today, we're going behind the scenes to talk about what patients usually don't see, especially inside of a freestanding ER. So today, I'm going to be joined by Dr. Ba, who works at SignatureCare ER, and we're going to break down how ERs usually function, the common myths about ERs, and how decisions actually get made about the time and what matters when you get to the ER. So, SignatureCare ER is on the corner of Summerhill Road and Mall Drive, and it is one of our ERs here in Texarkana. And so we're going to talk to Dr. Ba today. So let's get into this dose of Dr. C. Okay, so like I said, I was going to have a special guest with me today. So I've got Dr. Ba from SignatureCare ER, and if you've ever been there, you've probably seen him working really hard there, okay? And so we are going to open the script up so that we can talk about the things that actually happen in the ER. We want to know that, right? Yes, we do. So Dr. Ba,
yes.
What the people really want to know is what is the wait? Like, why when people go to the ER, does it seem like it takes so long to get back in the back? What's going on behind the scenes?
Well, usually, fortunately at SignatureCare, most of the time people don't have to wait very long.
Oh, that's awesome.
But generally, when there is a wait, people come up to the desk and they'll present their complaint. And we always have a triage system, even all the way from the front clerk all the way back. So if people come in with certain complaints, such as chest pain or stroke-like symptoms, they're obviously bleeding, or somebody brings them in a wheelchair and they're passed out, or they're screaming for help in the parking lot, that's obviously an emergency. And we have an alert system where we say triage, and the nurses know that this is different from a cough and a cold or a sprained ankle, and they need to come out right away to assess that patient and decide. So generally it goes from the clerk, and then the nurse triages fairly promptly, irrespective of the symptom, but obviously certain symptoms project a greater degree of alarm for the staff.
Right.
So they come and evaluate the patient, and then they decide, based upon the complaints, the severity of the complaint. So somebody's having trouble breathing, that obviously gets brought back right away. They alert the other nurses and staff, and then the physician as well. And then if things are less severe, such as I fell down yesterday and my ankle hurts, I'd like to get an x-ray, that tends to be considered on the lower tier of concern. So if our rooms are filled, then they would have to wait.
Gotcha.
But fortunately, we generally tend to be able to get people in fairly quickly.
The triage, so the more emergent it is, the faster back they're coming.
Correct.
And so one of the things that we need to make sure of is that it's an emergency that we're coming to the emergency room.
Sure.
Yeah. I talk to my patients about this stuff all the time. I wanted to make sure I said that.
Yeah. And we take care of everything that comes in, irrespective. But obviously, the more severe things get seen right away.
Right.
And sometimes people have to wait, and generally, I tell people when they do have to wait, sorry about your wait. But the fortunate thing is the fact that you had to wait meant you're not as sick as the people that were brought back.
Right. So they do have people that are checking to make sure vitals are good before, just to make sure that it's not something more serious, even though you came in with just a cough. Like if they go, well, wait a minute, the oxygen is 82.
82.
Yeah, you're just here for a cough, but you need to get on back.
Right.
So that's what the triage system that he's talking about.
Right.
Okay.
And that's why we always have a nurse come and assess.
Yeah.
Because sometimes you get this old farmer that never comes in that says, I just don't feel well, and they're having a heart attack. So, so we do have somebody to assess them and do their vital signs and everything else, and
Gotcha.
go from there.
Yeah, that's important to know. When people think that there's nothing happening, like nothing seems, I made it back in a room, great. But now it seems like nothing's happening.
Well, part of the process is getting the test ordered, getting the test done. And then also sometimes people don't notice because the doors are closed and because of privacy that the patient down the hall may be having a severe condition that most of the staff are attending to. And it seems like it's quiet outside, but there's a lot of activity in another part of the department.
Right. It's an emergency room, guys. So when ambulances come in and people come in and somebody is having a seizure or somebody is having a heart attack or a true huge emergency, a car accident, then even if you're waiting, those people have to go first. Okay, sorry. I'm just inputting. So there's some myths. We have some myths that people have about the ER. And I want you to either debunk them and be like, absolutely not, or say, no, that one's not a myth. That's true.
Right.
Or just tell me what you think about it.
Okay. Sure.
So, this one we just talked about. If the ER is quiet, then they'll get seen quickly.
Well, if it's truly quiet, we have rooms open, they'll get seen right away. Sure. But all the rooms can be occupied, and then from the outside it appears quiet because as we have patient privacy, we don't have the door. You can't see what's going on in the room next to you.
Right. What is something that is a misconception that specifically for a freestanding ER? Because SignatureCare is a freestanding ER.
Correct.
So we're not attached to the hospital. We don't have to do admissions and things. But what's a misconception that you think that people have about a freestanding ER?
Well, I mean, maybe the misconception is that that if they come in and they get accepted to the hospital, that if that they would just be sent right away, which generally they do get seen fairly briskly. But at the same time, if the hospital's full, then we have to keep them in our department. Whereas when I work over at St. Michael's, we keep them in our department as well. Too. That might be a misconception, but overall, we function as any other ER. We don't typically have ambulances arrive except to pick up patients to transport them. But we function like a regular.
See, I didn't know that. Okay.
Yeah.
Awesome. What is something that people may not understand about imaging or testing or labs? Is there something specific that you think?
Yeah. Well, I suppose it depends on what the complaint is and what the expectation is. Most of the time, if somebody comes in and say, I have belly pain, we do a CT scan. We say you have an appendicitis, but say you have vague symptoms that have been ongoing for months or years, you may not get a definite answer that day. We try to head you in the right direction, the right people to see. But our main goal is to make sure you don't have a life-threatening condition. And obviously, if we discover what is occurring, and most of the time we do, we treat that. But we don't always, but to come to the emergency room with a complaint that maybe has already been evaluated at the Mayo Clinic for a week, you may not get your answer that day.
Right.
But the main thing is that we do the testing, and we just make sure that you don't have anything that is life-threatening or immediately or in the near term life-threatening.
Now, that's, to me, on my end of it, when I have people come in for follow-ups, and those follow-ups are important, you guys. When they say follow up with your doctor, especially if you didn't get a specific answer, they say follow up with your doctor. On my end, I have people come in and say, well, they didn't do anything. And I'm like, what do you mean they didn't do anything? I'm like, well, yeah, they did a blood draw and they did a urine and they didn't do anything. They didn't tell me anything. And I'm like, well, they did the blood draw, so they knew that your infection cells were not sky high, and they did the urine, so they knew you didn't have a UTI.
Right.
And so for your fever, they said to follow up with your doctor.
Right.
And so I think on my end, one of the misconceptions is that if they don't get an answer, nothing was done.
Right.
And I want to kind of help people understand that that's where, especially for chronic things, that's where it's important to have your PCP follow up so that they can say it wasn't urgent or emergent. you're not dying today. We don't have to admit you to the hospital, but we do want you to have somebody that you can follow up with.
Yeah.
And so I think that's important, because what you guys are doing is making sure that it's not emergent.
Not emergent, correct.
Okay.
And
Awesome.
and we treat once. I mean, most of the time you come in and we know what's going on and we treat it. But occasionally you get these vague conditions, and we just make sure nothing serious is going on. But that's something that needs to be worked up as an outpatient.
Right. And sometimes they require referrals, and you guys, you guys don't do. You guys do referrals.
Oh, we do all kinds of referrals.
Okay.
Yeah. Back to the PCP, and then we refer to specialists.
Okay.
Too.
Well, see, I'm learning something, because see, I thought that you had to go back to your PCP to get the referral.
Oh no, no, we do most referrals.
Okay. Well, there you go. There you go, guys. You do get, but hey, you still should have your follow up with your PCP. Okay, so quick decisions. One of the things that people don't understand is how fast you guys have to make decisions sometimes.
Well, in real time, we make them split-second decisions. You come in, you're short of breath. I get a little bit of history of your back history, or sometimes I don't get any back history, and then I have to decide what to do next.
Yeah.
And there's always a protocol, and that's where all training comes in, when you come in with a specific set of symptoms, and that we quickly discern the level of severity and what the next step is. So decisions are made very brisk.
Yeah.
Correct.
That's why some of us has to do this outpatient, because that quick thinking. Okay, so that's awesome, knowing that you guys have to be on your P's and Q's to be able to know exactly what to do when it's needed, and that's necessary. And sometimes it is important to know, I've got to get to the ER.
Oh yeah,
right.
Definitely.
Instead of calling the doctor and wait until I can get an appointment. Those emergent, especially you keep mentioning breathing, shortness of breath,
stroke symptoms, chest pain, obviously trauma, bleeding, things like that.
Okay, very good. Can you share with us an example of a time where, well, we kind of mentioned one, shortness of breath or a cough, a time when somebody thought it was going to be just something simple, and it turned into something like, oh, that was not simple.
I had a case a couple of years ago. I had a lady, she has asthma. She had a viral sickness. She was coughing, having some wheezing. So she went to her PCP, and then she went to an urgent care, and she was just still saying, I'm coughing, I'm wheezing, I feel short of breath. Her oxygen wasn't terrible, it just wasn't normal. She was wheezing. I gave her some breathing treatments. I gave her some steroids, which is typical for asthma. And it's not unusual if, especially when you see these kids that have asthma and they get a cold, they're wheezing and everything. But went back to reevaluate her, and her lungs were perfectly clear. But her oxygen was not, it wasn't terrible. It was about 90%, which, we know that's technically normal, but we know the average person walking around is 96, 97, 100%.
Right.
So I'm looking at it, I think she's 90% and her lungs are completely clear. X-ray was clear. So I just told her, I said, just for the heck of it, I don't feel comfortable with this 90% O2 sat. It was 89, 90% with your lungs being as clear as they are. So I said, let's just get a CT scan of your chest. And I did a CT scan of her chest, and she had blood clots everywhere.
Wow.
And why she had blood clots, she didn't have the risk factors for it, nothing like that. It was just one of those situations that I just thought, oh, thank you, Lord, that I did that. Yeah, that would be one of the cases that I could think of.
Right. So he listened to his gut and his intuition saying that this doesn't seem right. I'm going to throw in, if you feel like you got sent home and you're not getting better, you did your follow-up and things are getting worse and not better, trust your gut too and go back, so that you can say, something's not right, something doesn't seem right, so that more can be done, or so that you can get reevaluated. Because again, we're going off of vital signs and how you present and things like that. And you go, well, I'm doing what they told me to do. I'm taking the medicine, take the medicine.
Yes.
I'm taking the medicine and it's not changing. Don't hesitate to say, I need to be reevaluated. Ideally first with your PCP, but if you can't get in, if it's emergent, go back and trust your gut. Okay?
And that's what I tell everybody. I tell them, if anything seems off kilter, we're here 24/7. So just come back.
Awesome.
And let us reevaluate you.
Yes, sir. Yes, sir. Good. Okay, let's talk about the patient side again for a minute. So if a patient is coming in very nervous, so I've only been on that side one time, well, outside of having babies, I've only been on that side one time where I had to go and I had an allergic reaction to a medicine. And I was even I as a doctor was like, oh my goodness, right? How can they explain what's going on if they're scared or nervous?
Yes.
What's a good, I mean, should they always bring somebody, or what do you think?
Well, it depends, obviously, depending on the urgency, but obviously with little children and sometimes with some of the elderly, it's always good to bring with somebody. But the main thing is just to keep it as simple as possible. What scared you? Are you short of breath? Do you have pain? And the other thing, I think sometimes people feel like maybe they'll be judged, and they don't realize that we don't judge them for. I mean, I've seen everything in my life. I mean, there's nothing you're going to say to me that's going to make me think anything other than just, I just take you as you come, and we just treat you.
Yes, sir.
And I tell people to keep it as simple as possible. Keep the symptoms. When did it start? And if it's something you've had before, how is this different? And the other thing is I always make sure if people can keep a list of their medications.
Oh, yeah.
Because we do have them in our computer, and even when I work over at the hospital, but what you're taking today may not be, it may have changed since it was put into the chart at some time in the past.
Gotcha.
So I always tell people if you can keep a list or even just bring the bag of bottles, that makes it so much easier.
Okay, that's important. So that's more, of course, that's more for our adults, our parents that are listening, because surely our kids are not on a list of things.
Right.
But for you adults, like, that's important. Like, that's sometimes the interaction of medicines. Like I said, I took one medicine and I had an allergic reaction, and I was like, what is happening? And I went to SignatureCare, by the way.
You? Okay, good.
And I had very good care there.
Excellent.
But that's important to know what you're taking. Like, put it in your phone, take a picture of it or something.
Yeah.
Especially if you're on a lot of stuff.
And then just tell us the truth as well. That's the other thing.
Truth. They don't tell you the truth.
Well, I mean, most people do, but some people they have something they're embarrassed about.
Gotcha.
And it doesn't help. I can't help you if I don't know what's going on.
Right.
And don't worry, I don't judge you. I mean, and so sometimes people withhold information because they're embarrassed.
I'm in an emergency. You don't know everything.
But don't just lay it all out there.
Gotcha.
And that way you can get the best care possible.
Okay. I think you just answered my next question. Okay. What helps people have a smoother experience in an ER setting and having the medicines?
Right.
Is there anything else that would make it go a little bit?
I would say also, if anything changes while you're there, to let us know, or whoever is with you, your advocate, to let us know.
Okay.
Because I'll have people, like, say, not necessarily with kids, but come in with a little bit of chest pain, and then the initial EKG looks good while we're waiting for blood and everything, and then the chest pain gets worse, and then we can repeat the EKG, and then we say, oh, wow, look, you're having a heart attack. So that makes it a whole different spectrum of care that you'd receive. Yeah.
Important. Yeah. Changes, telling you any changes. Is there a question that they should ask that they should always ask before leaving? Is there something that they should ask the doctor or the discharge person before they leave?
Anything they don't understand. Like, so if you don't understand the medication we're giving you, or your diagnosis, or the plan of care, just ask. I mean, don't feel embarrassed to ask. You may have been told and maybe didn't understand, and if you didn't understand, just ask.
Gotcha.
Because I'd rather you leave knowing that we're all on the same page and that there's a plan in place than to have then a patient leave confused and not feeling like they have good care.
Here's the side note, guys. On my end of it, when you guys come after your ER visit and I say, what were you there for? Or what did they diagnose you with? And you say, I don't know.
Yeah.
It's really hard on this end of it too, if you don't get at least like a discharge paper, or if you don't know that, can't understand the name of it, have them to write it down. So for the follow-up, I can know if I need to do something on this end. Do I need to repeat labs? Was it something that you were taking medicine for? Why didn't you go pick up the medicine that they said they were sending? Like, I need that information. Your PCP that you're following up with after the ER visit or hospital admission needs that information so they can make sure they're giving you the best care. So, yes, please get an understanding of what you were discharged with? What was the diagnosis?
Every patient we discharge has a folder with all the medications, the diagnosis, and the discharge instructions as well.
So it may be good to bring that, like when you go to your follow-up afterwards, even if you're feeling better, to bring that envelope, that folder with you after you leave, okay, so that we can see that information too, or what was done. Okay, we're almost done here. Okay. This has been great, right, guys? Okay, so I've got some it's called quick fire questions for you, okay? So we're just going to ask a few things and then we'll close. Okay. So what's one myth that you wish didn't exist about a freestanding ER? Well,
we are an actual ER. So, I mean, sometimes people look at us as urgent care and have the mindset that we're limited as an urgent care, but we can do CT scans, we repair lacerations, deal with broken bones, take care of heart attacks. We do it all just like a regular emergency room does.
Gotcha.
And that would be probably the biggest myth, is thinking that, oh, well, that is an urgent care. But no, we're an emergency room.
Well, there's a difference from an emergency room.
And nothing wrong against urgent care. I mean, we get referrals from urgent care all the time. It's just like urgent care in clinic, there's only so much you can do. Mm-hmm. Right.
But now, as a freestanding ER, you can do anything that the emergency room can do.
Correct.
And then if there's a need for an admission to the hospital, you still are able to go and send them to the hospital for an admission.
Correct.
Okay. One thing that patients do that help you more than they realize?
Just letting us know what they're there for, and giving the symptoms as clear as possible as to what symptoms you're having. Okay. That makes it as easy as possible. Plus having current list of medications.
Current medications, and be a good historian.
Yes.
People don't go and say it's been going on for, a little bit of time. Well, is that like a couple of days or a couple of hours or a couple of months? What's a little bit of time? Yes, I'm fussing at you. Don't give these people random information like, when did it happen? I don't know. What? Okay. I like to fuss at patients a little bit. Okay. Okay, last one. One thing that patients don't realize that the ER doctors and nurses actually care about. Like, what's one thing that they don't realize that you guys care about?
Oh, that we care about. Well, we care about the patient. That's the most important thing. We care about their symptoms. Where we try to do the best that we can for them. And then even if sometimes they have to wait, it's not because we've forgotten them. It's because the processes are occurring, but that we do care, and we want the best care for them as possible.
Right. Yeah. So even if I give you guys a hard time, I tell my patients all the time, don't go to the ER. Go to the ER if it's an emergency.
Yes.
Otherwise, call your PCP. But they actually care. He's telling you, the ER doctors, the ER nurses, the triage nurses, as soon as you walk in there, they care about what's going on with you. Even if this is not the person that you've been seeing all the time, if they're closed and you have to go somewhere, know that they care. Know that they want the best for you, just like your PCP does. I just give y'all a hard time. Okay? Thank you so much. I appreciate your time.
Oh, thank you. Thanks for having me.
I'm so glad that you came and gave them a little eye-opening to what's happening and why they feel like nothing is done, or they're waiting too long, or things like that. Like people need to know what's happening behind the scenes, and that you guys are triaging and doing everything you can, but you have to do it in an order. And so I love that. I'm glad that you're here, and I'm glad that you helped me.
Well, thank you so much. It was good to see you.
Good to see you too. Thank you.
Appreciate it.
Okay. Let's set the Artlist.io. Step by step, raise the whole room higher.